Upon presentation, a shock, who prefers to be known as Ash, describes the recent disruption to his sleep-wake cycle pattern that caused him to seek initial medical help from his doctor. Ash notes that he has been experiencing sleeping issues for the past 3 to 4 months, which have progressively worsened over the course of the last few weeks. Ash experiences difficulty initially falling asleep, as well as sustaining a regular sleeping pattern throughout the night, waking several times. He typically wakes around 5 to 6 a.m., remaining awake for a short period and then drifting off to sleep again. In accompaniment to this irregular sleep routine, Ash also describes experiencing a loss of appetite over the last few weeks, typically consuming one large meal and small snacks throughout the day. Ash continues to detail the hardship he is facing, trying to find work in the engineering field post-graduation, and how the success of his fellow peers and cousins in successfully attaining an engineering job has led to his increased social withdrawal. As a result, Ash actively avoids hanging out socially with his cousins and friends, describing feelings of jealousy towards them. Ash notes he also has reduced his participation in activities that he once enjoyed, such as reading, and instead spends most of his days in his room watching television or playing video games. When prompted further by the mental health professional, Ash noted that he was also experiencing some dysphoria regarding his career choice and hinted toward a general conflict between what he wants to do and what his parents have chosen for him. Whilst he's unsure of what exactly he wants to do, he is unhappy with engineering and would instead prefer to explore arts programs and careers. I believe this to be the initial cause of Ash's problems. Ash also mentions that he has had a generally lower mood than normal over the last few weeks, particularly in the last few days. On a scale from 1 to 10, wherein 1 indicates the lowest mood and 10 the highest, Ash scored his mood as typically falling in between a 3 and a 4. Additionally, Ash appears to have limited support from family. Ash has 1 younger brother and 2 younger sisters that he has to care for. Ash describes this as a big responsibility and attributes this as to why he does not feel as though he can open up to them. Even though he lives at home with his parents and siblings, he does not feel as though he can open up to them. Noting the risk of stigmatization due to sociocultural attitudes towards mental health. From the brief provided, it is clear that Ash is experiencing a transitional phase in his life and has inadequate resources to support himself. From describing his current state, Ash appears as though he has a lack of control over his life, his career choice, his living situation, and now his sleep pattern. Looking at his overall experience through the biopsychosocial, cultural, spiritual factors that have contributed to Ash's overall health concerns, I shall begin with the biological factors. Ash opens with his struggle sleeping and how his issues falling asleep and maintaining sleep had begun affecting him and becoming a concern. I'd be interested to discuss with Ash further his previous sleeping habits and sleep routine, both as a guide to how drastic this change has been and also as a tool for treatment. Establishing Ash's routine to sleep and sleep hygiene practices that he uses and can implement, such as moving devices from the bedroom at night, can help improve sleep quality. Ash also described a day-to-day routine that primarily consists of staying indoors, watching TV, and playing video games. Ash's physical isolation and lack of time outdoors, in combination with his loss of appetite and social withdrawal, contributes to the irregularity of routine reflected in his sleep pattern. There is little family, mental, or physical health history provided, which may be difficult as he has difficulty opening up to them and his parents do not discuss mental health. Nonetheless, it would be worth gauging Ash's family, mental, and physical background with him. A family history can be one of the best predictors for heritability of mental health disorders and issues that Ash may be experiencing or may face in the future. It provides us with a broader picture for diagnostics and treatment, which has been outlined by Adolescent and colleagues, and is a less involved process than a family study, which would involve interviewing Ash's immediate family to gather a history. Psychologically, Ash has expressed a low mood as of the last few weeks. However, I would be interested to inquire into his previous mental health history as to whether he has any previous experience with bouts of low mood or depression. Previous experience can be crucial for diagnoses, but also a beneficial tool in developing a greater and more complete understanding of Ash. There may also be deeper-rooted issues that Ash wasn't able to articulate within the brief period of time provided, that he may benefit from discussing with a mental health professional further. Something I did note as a concern is his rumination regarding his lack of success finding work post-graduation, as this can be a relating risk factor for depression as outlined by Spasivic in 2001, as well as for insomnia. I believe this to be an area of great importance to target in his treatment, particularly due to Ash's experiences with disturbances in his sleep pattern. As his recent routine post-graduation seems unproductive and socially withdrawn, it would be good to gain an understanding of Ash's values and what his ideal routine looks like. This not only gives us a greater understanding of Ash, but also gives him and his health professionals an idea of what to strive towards. Socially, Ash appears to have withdrawn from his family and other university peers that have seen success in landing an engineering position post-graduation. In addition to this self-isolation, it doesn't appear as though Ash often leaves the house, spending most of his time playing video games and watching television. I'd like to establish what a typical day and weekend or socialization would look like for Ash prior to this episode, to gather a more extensive history as well as have a goal for Ash when working towards healthy socialization practices. Whilst not explicitly discussed, as Ash lives at home and does not have a job, he may also be struggling with financial and emotional independence. Not having a steady source of income can lead to further strain on interpersonal relationships, as outlined by Lempers and Clark-Lempers in 1997, and increased symptoms of depression and distress, outlined by Conger and colleagues in 1999 and 2000. This would be of value to discuss with Ash and look for other available income options to address this. Ash also describes having to care for his younger brother and 2 younger sisters and how this is a big responsibility for him. This dynamic is called parentification and was outlined by Boszormenyi-Nagy and Spark in 1973, wherein Ash has taken over some parental responsibility for the care of his siblings, which is seen more frequently in immigrant families, outlined by the Titzman study in 2012. Parentification can lead to a higher level of self-efficacy, which is evident in Ash's completion of his degree. However, it can also lead to exhaustion, which was also outlined in Titzman's paper in 2012, which could be adding additional strain to Ash's sleeping and routine issues, as well as motivation to find work. It would be of high importance to discuss this dynamic further with Ash and to factor it into his ongoing treatment. Another important aspect to acknowledge is Ash's cultural background. He identifies as being from Southeast Asia, a region that Ash notes mental health issues are stigmatized. Ash believes this is reflected in his parents' attitudes towards mental health issues, and as such, he feels uncomfortable opening up to them about his recent struggles and his true passions and career choice. The stigmatization that Ash is anticipating may be reducing his self-esteem and self-efficacy, outlined by Kirsch, Krupp and Long's 2018 paper and Crow, Mullen and Littlewood's paper in 2018 as well. It would also be invaluable to explore how Ash interacts with Australian culture and whether this has an additional support or strain on Ash's ongoing situation. How does Ash feel in his community, and does it aid or abet his sense of belonging? There is supporting literature from Okazaki and Tokuchi from 2009 that outlines the tie between culture, community, and mental health in South Asians who had emigrated to America. The study found that South Asian men experienced high psychological distress when there was great conflict with family culture and when status in the community is low. In order to get a more in-depth understanding of Ash and his sense of identity, it would be of worth to investigate aspects of Ash's cultural identity and community to better assist him in his mental health journey. From the excerpt provided, not much is revealed about Ash's spiritual background, beliefs, or connections. Whilst a relatively new approach to mental health, spirituality, and/or religion can be important for the evaluation processes of mental health, as well as an aid to help cope with life stresses outlined by Verghese paper in 2008, spirituality has previously been assessed as being linked to neuroses, which was outlined in Cow and colleagues' paper in 2020. However, recent research has shown that religion and spirituality can be a key supporting keystone for mental health and can be a powerful source of comfort, which was outlined by Koenig's study in 2010. It will be of great use to investigate further as to whether Ash has any existing spiritual or religious ties or ones he wishes to form that would help him for strength or for guidance. If Ash does already have religious or spiritual ties or wish to pursue them, it also broadens his support system that is available to him, whereas there is an opportunity for working as a psychopastoral relationship, as outlined by Sims in 1994. By gaining a better understanding of Ash's values through spirituality or religion, we may also be able to help him with guidance in his career path, which was found in the Duffy and colleagues paper in 2010. By further exploring spiritual and personal values, Ash, with the assistance of career counselors and a mental health team, may be able to clarify his career goals, which could improve his overall well-being. I look forward to meeting with Ash personally and further assisting him on his mental health journey.